Welcome back to another edition of the Daily Vlog. My name is Dr. David Duizer. Thank you so much for tuning in. I'm a naturopathic doctor focused on chronic disease management, and this is our YouTube channel. So thank you so much for tuning in. We talk about holistic health and wellness here, and so if you're interested in that topic, please subscribe for more videos like this one. We're doing integrative medicine, functional medicine videos. I really want to dive deep into a few topics this week if I can. Today we're talking about cardiovascular risk assessment and treatment. But I want to talk about the different types of depression, how they differ, how they're evaluated, the documentation we use, the questionnaires we use to determine what the state of depression actually is, because that's really important for guiding therapy. If someone is in the mild or moderate stages of depression, then pharmaceutical usage might not be beneficial. We might start with counseling, exercise, supplementation, for example. But in more severe cases, in severe depression, for example, or in the new persistent depressive disorder, we may consider medication in conjunction with the holistic approach. So we're always thinking about sleep optimization, stress reduction, nutrient support, exercise therapy, for example. But the real tricky thing is in integrative practice is when do we need to, when should we be approaching the medications in mood disorder? So we'll do a video on that one. I also want to do a video on metabolic flexibility, metabolic efficiency, talking about metabolism in general, how to improve it, how to be a calorie burning machine at rest, for example, how to optimize workouts. These are the type of things that I want to be talking about on this channel, so expect more of that with us here. And the third thing I want to talk about this week, if possible, is mindfulness-based therapy in generalized anxiety disorder and in chronic stress. Anyhow, aside from the diagnosis of generalized anxiety disorder, I just want to talk about mindfulness and how powerful it can be for those who are experiencing significant symptoms of stress. Right now, throughout COVID, of course, stress is really high. It's high for other reasons, of course, too. But I think talking more about mindfulness will, or approaching the concept of mindfulness more often, could spark interest in people. I think it's a really powerful therapy. I appreciate the therapy. I think that my patients benefit from it. And so I'm going to bring it to this channel and talk about it as much as possible. Today I want to talk about cardiovascular disease management. I've done videos like this before on this channel, but really what I want to discuss is kind of the most typical situation I get in practice, which is someone brings lipid labs, so cholesterol labs, and says, what's my risk? What should I be doing? How long do I have, doc? What's going to happen here? And I'd like to go through just a really quick way we like to look at these labs. If you're familiar with the channel here, I use Framingham risk assessments. I use other calculators too, but I revert to Framingham a lot, just to get a quick assessment of the labs. So let's go through an example here today if we can. Let's see if I can get this to work. Scan here. Okay, so is that working? Yeah. Okay, so a little example of a Framingham risk assessment. So I usually either go to this website or prop open my book and plug in the values. So this actual calculator doesn't take into account diabetes, because this is a Framingham risk score for hard coronary heart disease. There are other Framingham calculators that you can use, but if someone doesn't have diabetes, then this is a good one. Anyways, you plug in the age, you plug in the gender, do they smoke or not, what's the total cholesterol? We're in Canada here, so we're doing millimoles per liter. What's the HDL cholesterol, millimoles per liter? Systolic blood pressure, that's too high. And blood pressure, is it being treated with medicines? Yes or no? And so then you get a 10-year risk of myocardial infarction or death for this patient compared to the average risk, average 10-year risk for someone in that age bracket. And so it's kind of nice to see kind of how people compare And it's really quick to be able to do this with patients in front of them. So the question I get posed a lot is, my total cholesterol is high. Total cholesterol here, 7.14, which would be considered high. The range on total cholesterol here in Canada is up to 5 something. So 7.14 is high for total cholesterol. But in this setting, what about HDL? And so we're always thinking about the ratio between total cholesterol and HDL cholesterol. It should be low, the relationship between these two. And we'll talk a little bit more about that in a second. So the range for HDL here in my region is anything less than 1.19, or anything greater than 1.19 is normal. And so let's say someone's right on the border. Say they have a 1.19. Oh, I lost my screen. Say they have a 1.19. So they're right on the border. With a systolic blood pressure of 120, and at the age of 70, their 10-year risk, now it's jumped. But let's say their HDL gets a little better. The HDL goes to 2.2. Okay, now the risk is down, the risk is lower. Let's say the blood pressure goes even lower, because we know as we age, for a lot of people, blood pressure can go lower. Oh, the risk went down. Okay, now we're down at 2.0. So these are the kind of things I like to show to people while we're sitting there. When we do that, of course, we can make suggestions about the potential for change. Like, for example, we know, let's say someone has a risk profile that's a little bit more dangerous. Let's say their HDL cholesterol is on the 1.19 range again. And their blood pressure, let's say the blood pressure is a bit high. Let's say the blood pressure is, 135. Okay, let's say the blood pressure is 135 systolic. And so now we've got a risk of 6.9. Okay, well, what's going to happen here? So let's say, okay, we know that if we do 400 milligrams of magnesium per day, that we could probably get 4 or 5 points of reduction in systolic blood pressure over time. And so let's say we change that to 130. We've gone down from, 6.9 down to 6.3. Average 10-year risk. And so just with a very simple blood pressure change, average blood pressure drop of 5 points, we can have some significant improvement here. Let's say the HDL changes and the HDL goes, or let's say we suppress cholesterol. So we do, let's say, okay, person's deciding, should I be suppressing cholesterol or not? Let's take a natural remedy, something like a complex natural cholesterol suppressor. Usually we can get about 2 points of total cholesterol suppression using a natural suppressor. Let's say, so we can get it down to 5.14. Let's call it 5.0. Oh, we went from 6.3 down to 4.5, which is a big jump. By taking a supplement for 8 to 12 weeks, we got that down 2 points, and now we have an improvement in our risk profiling. So this is the type of work that I like to do with people in office. And we kind of can run through this, and it's quite efficient to use and quick, and you can turn the screen towards the person. If you're wondering about your results at home, go and plug in your results to some of these calculators online. If you scroll to the bottom, usually you can find the references for where the calculators came from, and then you can determine if they're valuable or not. Like, for example, this is referenced originally. It's from the journal Circulation, which is a highly reputable journal, and then 2 other references here of course, New England Journal of Medicine and JAMA. So 3 top journals publishing about Framingham. So you can scroll down, and usually you can find where the calculator was developed from, what the study was, who was in the study, and you can determine if it's a good use for you or not. You can also ask your primary care provider or your integrative medicine provider if they can help you with a good calculator. What is my risk? What should I be doing? How can I tweak to achieve optimal cardiovascular health long term? Because that's really what we're going for here. We're trying to find places where we can exert some positive influence with natural therapies, non-invasive, minimal side effect type therapies, but have a big outcome. So, for example, maybe we what do we do here? We start doing some light jogging. We do some light jogging. Maybe we get more of a blood pressure suppression. Maybe we do a little bit of diuretic tea, for example. Maybe some dandelion tea. Maybe we add some beetroot juice, and then all of a sudden maybe we're getting 5 more points, right? Maybe we're down to 125. I'm gonna lose my page again, but I'll do it anyways. Oh no, we're good. Maybe we're down to 1.5. Okay, now we went from 4.5 down to 4.1. All we did was jog a little bit and add some tea. See what I'm saying? So these are the things that are quite helpful that we can be doing. So play around with the calculator and see where you fit. Now, what do I do next? The next thing I do is when someone has specifically total cholesterol of 7, and in Canada here they always publish with the lipids. They publish total cholesterol to HDL ratio and call that the risk ratio, and that was determined to be an excellent ratio to be following a very long time ago. Now we actually like looking at HDL versus triglycerides, but LDL versus HDL has been looked at as well. And one good study that has checked this out was published way back in 2001 in JAMA Internal Medicine. And let's see if we can get this one up. This one here was the Quebec Cardiovascular Study. This is a really good one, and they're looking at the risk ratio. So looking at total cholesterol versus HDL, they're looking at LDL cholesterol versus HDL as indices for ischemic heart disease risk in men. And this was a really good one because it really said that the one that we should be looking at in this group is total cholesterol to HDL cholesterol. And so some of the graphs they publish here, what do we look at? We look at on the bottom graph here. This one here is interesting. Quintiles. Is it quintiles? Yeah. Let me make it a little bigger for myself. Quintiles of total cholesterol to HDL ratio. So as that risk ratio goes up and up and up, IHD, ischemic heart disease odds ratio increases. So in Canada here they have it set at 4.4. So the TC to HDL ratio, we want that to be less than 4.4. So in optimal medicine, we're looking to get that less than 4.0. You can see 3.74 was the lowest risk of ischemic heart disease here. That was the one. So we're always trying to get down to this number here. So I like to show that to people who have high total cholesterol, but also high HDL. Like, geez, should I be suppressing this total cholesterol? Yes, there could be a role for that. We know that, not all cardiovascular events are caused by that are exclusive to cholesterol, and the ratio here, total cholesterol to HDL, isn't the be all end all. And there are other things to consider, like inflammation, for example, in the setting of high total cholesterol, clotting cascade in the setting of high total cholesterol. Even when it comes to cardiovascular function, even heavy metal exposure, for example, lots of things. Stress, insomnia, lots of different things can contribute to cardiovascular disease. But when we're just looking at the risk ratio and it says, okay, should we really aggressively suppress total cholesterol or not? I like to pull up this graph. Like, where is your total cholesterol to HDL ratio? And, if it's at the 5.6, we can say the odds ratio, there's a 2.6 increase compared to that one. Anyways, a significant increase of 2.6 times the risk of a cardiovascular event. If we're at 4.85 with the risk ratio, double the risk of ischemic heart disease. That's not good. If you're way up here, 4 times the risk, that's serious. Now, this study was looking at comparing LDL to HDL ratio versus total cholesterol to HDL ratio, and you can see it wasn't so helpful. As the ratio of LDL to HDL ratio went up, the ischemic heart disease odds ratio did not increase. There was this jump here, but there was nothing that happened in the second and third quintiles. So that's why we use total cholesterol to HDL ratio. It's a straight line going. Okay, what do we have next? This part of the study showed about body mass index and high insulin. and the breakdown of cholesterol carrying proteins. So, for example, normal lipidemic men, you can see there their body mass index, 25 versus the 27. This is the dyslipidemic men. So they had they had more VLDL, which is a lot dangerous. They had less HDL, which confers an increased risk. Those people also had higher body mass index. They had higher fasting insulin. They had much higher triglyceride to HDL ratio, and they had higher LDL to HDL ratio. So, it suggests that body mass index is something that we should be working on. We should be trying to help each other become leaner. And we should be suppressing insulin in this setting. We should be looking at triglyceride to HDL ratio. Hopefully, in bringing these levels down, we have an impact on VLDL and we can boost HDL. So they standardized these groups. They took these two groups and they took they looked at LDL in the setting where the LDL was exactly the same, and they tried to see what was different about these two groups. Otherwise, if the LDL was the same, well, there was a big difference in VLDL, there's a big difference in HDL, and of course, all these other biomarkers, there was a big difference. So interesting. Now, these are tertiary levels of triglycerides. I threw this in here because I always like to talk about triglycerides as well. Check this out. Triglycerides. As triglycerides go up, this is why we're looking at triglyceride to HDL ratio now. But anyways, as triglyceride level goes up, the total cholesterol to HDL risk ratio goes up. Yeah. So, got to keep those triglycerides low. That's really, really important. Anyways, that's what I want to talk about today. That's just some of the work that we do in cardiovascular risk reduction. We need to look at the fine details because we need to see where we can exert a positive influence in integrative medicine. Like, what type of nutrition changes should we be making here? Should we be reducing saturated fat? Well, in the setting of low HDL, high LDL, and high total cholesterol, high triglyceride, yes, we should be reducing saturated fat. At the same time, we should be restricting carbohydrates slightly. But if the risk ratio is really good, like let's say the risk ratio is down at that 3.7, where there was the lowest ischemic heart disease risk, how much work on cholesterol do we actually need to be doing? Maybe we need to be thinking more about inflammation and sleep and exercise and stress reduction in those settings for cardiovascular risk of disease reduction. But, or maybe we need to be turning our eye to the triglyceride level. Where is the triglyceride level? It's the most sensitive level to diet. So if you really want to assess your diet, and you're worried about your LDL and total cholesterol, have a look at your triglycerides. Are they elevated or are they not? And that can give you some guidance as to if you should be improving your dietary habits or not. And that's kind of the way I like to do it. So these graphs are really easy to pull up for people, and it kind of like sets the stage for cardiovascular risk reduction. Of course, in another video, I think I went a lot deeper into the other biomarkers that we use, including LPPLA2 and LP(a), and ApoB100 and all these other great and genetic assessments, for example. I think I have another video with all of that. If not, maybe I'll do one. But detailed cardiovascular exam, of course, top of the list for anxiety, because it is the number one thing that gets North Americans. So stay on top of your heart health, and that also includes keeping track of your blood sugar, keeping the insulin low, keeping your body weight low, body mass index normal, in the normal category, please. Sleeping well and keeping stress low, of course. That's the Damie vlog for today. I hope you enjoyed it. If you like videos like this one, subscribe to my channel. We'll keep doing integrative medicine videos and talking about the clinic and talking about what's going on with us, and trying to provide lots of value for longevity and wellness and optimal health. So if you have questions for us, let us know. Otherwise, we'll see you in the next video, and we'll keep going. Stay healthy and stay well.